Hi everyone, I'm Stephanie with 9 Health. We are talking all month about preventing chronic conditions, reducing your risk for these chronic conditions. We talked last week about diabetes. Today we're talking about your heart health, things like heart disease, stroke, heart attacks, and assessing your cardiac risk. We have a new online risk assessment you can take, and I'll put the link in the comments. I want to introduce our experts. I'm joined via Zoom by Kendra Taylor. She's the Program Director for the Cancer, Cardiovascular, and Pulmonary Diseases Program at the Otero County Health Department. And also Taryn Buford, a public health nurse with the Otero County Health Department. We made our new online risk assessments available in the southeast area of Colorado, that lower Arkansas Valley first. So we're glad to have some experts from that area. So thank you for joining us. And then I also have 9 Health expert, Dr. Paolo Coley, joining us as well, who's a cardiologist, so obviously an expert on all things heart health, but also an expert on preventive medicine and internal medicine. First, Dr. Coley, you talked about this on the 9 News Morning Show this morning, and we're kind of just digging a little deeper. So if anyone wants to ask questions, they can in the comments, and we'll get those answered. Explain some of the heart issues that we normally hear about, things like heart disease, stroke, heart attacks, how they're all related.
Yeah, I think it's really important to try to understand what people mean when they say heart disease and what the risk factors are. So let's talk about the process of atherosclerosis. So atherosclerosis is a word that basically defines deposition of cholesterol or plaque in the walls of the arteries. And if it occurs in the walls of the arteries around the heart, it's called heart disease or coronary artery disease, because the coronary arteries are the arteries that supply blood to the heart. If it occurs in the blood vessels that supply blood to the brain, like the ones in your neck or in the brain itself, it's called cerebrovascular disease. And if it occurs in the legs that supply blood to your legs, that's called peripheral arterial disease. So the exact same process, which is atherosclerosis, but occurring in different vascular beds or different blood vessels around your body, can cause different sequelae. So because there's inflammation in the wall of the blood vessel, that inflammation over time causes a lot of chronic changes in the walls of the blood vessel that can actually cause the cholesterol to spill into the artery. And when the cholesterol spills into the artery, it activates the body to actually create a blood clot on top of that cholesterol. And that's called a thrombus. And so if you get this thrombus occluding blood flow in this artery on top of this cholesterol deposit, you can have complete cessation of blood flow. And if it happens in the heart, that's called a heart attack because you have lack of oxygen to the heart muscle. If it happens in the brain, it's called a stroke because you have lack of oxygen to the brain. And if it happens in the legs, it's called acute limb ischemia because you have lack of oxygen to the legs. So atherosclerosis is a process that takes many, many years to occur. It doesn't happen just overnight. Some people say it can start occurring as early as in your 20s. And so that's really the time to start to think about modifying your risk factors. And if you think about why it occurs or what the risk factors are, it's really anything that damages the walls of the blood vessel, or if the cholesterol sticks. So the damage to the walls of blood vessels makes the cholesterol more sticky. If you have a lot of cholesterol, that makes it stick more. And then of course, things like diabetes, hypertension, all of those can damage the arteries as well and make the cholesterol stick. So we'll talk a little bit more about risk factors in a few minutes, but that's kind of an overview of what heart disease is, what stroke is, what heart attacks are. And then once you have that framework, you can think about how you can prevent these.
Great, and we have new online risk assessments. One is for cardiac risk, your heart health. I posted the link just now in the comments so you can assess your heart health right now while you're listening to us. Go ahead and ask your questions if you have any on keeping healthy right now, especially during this COVID-19 pandemic. We want to make sure that you're taking care of your health, making sure you're the healthiest you can be. Kendra, can you list some of the causes of these heart issues? Again, Kendra Taylor is with the Otero County Health Department with their Cancer, Cardiovascular, and Pulmonary Diseases Program. So an expert as well, and you can answer some of these questions. List some of the causes of heart issues, things that increase our risk for heart disease.
So some of the things that will cause a heart disease is high blood pressure, high blood cholesterol levels, and smoking. Some additional risk factors to take into consideration is if someone has diabetes, if they are overweight or obese, if they have an unhealthy diet or physically inactive, or if they have excessive alcohol use.
Yeah, I think a lot of the risk factors for a lot of the conditions that we talk about are kind of the same. Like you want to just try to overall be as healthy as you can be. It's easier said than done sometimes. Taryn, can you talk about some of the recommendations for keeping our heart healthy?
Sure. So along with what Kendra said for the increased risk, of course, you want to try to stop smoking, decrease smoking, encourage your loved ones to cut back or quit smoking. Also, you want to make good nutrition choices, limit your saturated fats, try to increase your vegetables, fruit intake, that helps. High blood cholesterol, you also want to pay attention to that, keep your levels within a healthy range. Manage your diabetes. Diabetes and heart disease goes together. So you want to make sure to manage both things to avoid complications later on. Reduce stress. Right now it's a big time with stress, everything going on. Make sure you take time for yourself. Huge thing, manage your stress. And also limit alcohol and increase your activity.
And Dr. Kohler, if you want to add to that, I know you broke it down really well on the 9 News Morning Show this morning, some ABCDEs, risk factors for reducing your risk, if you want to spell that out for us as well.
Yeah, I always have trouble remembering things, so I like mnemonics. So this is a really cool mnemonic for modifiable risk factors. So A stands for alcohol, as you guys just said, less than 1 drink if you're a woman, less than 2 drinks a day if you're a man. B stands for blood pressure. So ideally you want to be less than 120 over 80, but the absolute is 130 over 80 before someone will start medication on you. C stands for cholesterol. So you want to keep your bad cholesterol, that's the LDL, less than 100. And you also want to quit smoking, as you said, Taryn. So C also stands for cigarettes. So because if you smoke, that can damage the walls of the blood vessel, make that cholesterol stick. D is for diabetes or pre-diabetes. So you really want to try to minimize insulin resistance or glucose intolerance, any of those things that can lead to risk factors for heart disease, because that extra sugar damages the walls of those blood vessels also. So that's what makes that cholesterol stick. That's why heart disease and diabetes go hand in hand together. Same with stroke and diabetes. And then E is for exercise. You want to try to get at least 150 minutes of exercise every week. And that can be broken down into about 22 minutes every day or 30 minutes 5 times a day. And what we're talking about is moderate intensity exercise. So brisk walking, running, dancing, Zumba, biking, anything that gets your heart rate up. So you want to definitely be, giving yourself a cardiovascular exercise. You don't want to be walking so slow that you could have a conversation with somebody on the phone, and you don't want to be walking so fast that you can't get a word out, because then you're probably pushing yourself too much. So that's your ABCDEs of what you can modify. Other things, as you guys discussed, that are out of our control that can affect our heart risk are things like age. So age is one of the strongest risk factors for developing heart disease. Adverse pregnancy outcomes. So if a woman has had gestational diabetes, gestational hypertension, low birth weight baby, that increases her risk. If a woman has a history of PCOS or polycystic ovarian syndrome, that can increase her risk. Premature menopause can increase a woman's risk. Certain race or ethnicities are higher risk for developing premature heart disease, such as South Asians and Hispanics. And then family history is a strong, strong predictor as well. So if you have a family history of premature heart disease, and remember what I said, age is the strongest predictor of risk. So you have to think about when somebody in your family had a heart attack. So if your dad had a heart attack at the age of 80, that doesn't count as family history because it happened when he was very old. So it has to be a heart attack in a male relative less than 55 or in a female relative less than 65. And that's really what you want to keep in mind when you count family history. So as you said, Stephanie, there's a great calculator online at 9healthfair.org that you can put your personal numbers in to get a personalized risk assessment to really try to understand your risk, which is the first step in trying to modify it.
Yeah, and again, I put that link in the comments, and thank you for explaining the 55 thing, because I did the assessment the other day and I was like, well, I have heart, issue history in my family, but why does it say 55 and under? Like my grandma had heart disease, but it was, older onset when she was older. So yeah, now that makes sense. I also wanted to ask you, I was just looking at our screen again. Again, you can click on the link in the comments, but it talks about angioplasty or stent placement. And as far as like history, I think, when assessing your risk, can you explain what an angioplasty or stent placement is, how that relates to heart health?
So remember, we talked about blockages in the blood vessels. So the Latin word for blood vessel is angio. So angio means blood vessel. Plasty means if someone has done an intervention to try to open up the blockage. So think of it like roto-rootering your blood vessels open. So if you've had an angioplasty, that means someone's gone and done a little bit of a roto-rooter on the blockage that's there. And if you've had a stent placement, that means they've actually put in a little metal tube inside the blood vessel to keep it open. So it's like roto-rooter with a little metal tube to keep it open. Those are interventions that are usually done either when the blockage has gotten too big and it's restricting blood flow on a day-to-day basis, or they're done if you know, the heart muscle is not getting as much oxygen as it needs on something called a stress test, which is a test that we use to diagnose heart disease. We haven't talked a lot about diagnosis, but in order to know for sure whether you have heart disease, you need to either have something called a stress test, where we actually put your heart under stress and then take before and after pictures of it to try to see if it's getting enough blood flow, or you need to have something called a cardiac catheterization or an angiogram, where you actually put a catheter into the blood vessels and take pictures of the blood vessels to see if they're getting enough blood flow. But those are the two definitions that you inquired about. And one of the biggest predictors of risk is prior risk. So somebody's already had a heart attack, that's one of the strongest risk factors for having another heart attack in the future.
Okay, yeah, that's just another thing when going through that risk assessment. I'm like, angioplasty, there's all these terms on there, and it does explain in the tool, in the calculator, kind of those things, but I wanted to just get your definition as well. We are getting some questions on Facebook. Taryn and Kendra, maybe you can answer this one. Someone asked, what can we do to dissolve built up plaque? This was from Audrey. So talk about, I guess, that goes along with reducing risk, but she asked dissolving built up plaque.
So that would be, you know, of course you want to watch your diet, alcohol intake, manage your diabetes. It just goes back to the different ways of prevention. Also, genetics and age, of course, plays a strong role too. So with the help from the diet, sometimes the use of medication is helpful as well.
And I just want to add just a little bit to that. Once the plaque is built up in the arteries, it's very challenging to make it go away because it actually kind of gets stuck in there. There's one medication called a statin medication, which you may have heard of, Lipitor, Crestor, atorvastatin. A lot of people use it, which is the only medicine that's been shown to regress or reduce the volume of the plaque just a little bit. But more than so much making it go away, we want to prevent it from sticking in the first place. That's really why we talk about prevention, because once it sticks, it's really hard to take it out and remove it. The other thing you can do to actually make the plaque less of a risk, because remember I talked about the plaque rupturing and spilling into the artery, is to actually increase the thickness of the cap on the plaque so that even if it's stuck in the walls of the arteries, it's not spilling into the arteries. And medications like statins can do that. Managing inflammatory markers, keeping your stress down, those types of things can make that cap on top of the plaque a little bit thicker so that it's less likely to spill out and cause a heart attack or a stroke.
And then Kendra and Taryn, maybe you can also address, you know, what each of you, your roles at the Otero County Health Department, how you help people in your community. Is it through education? Do people come to you already with a heart issue? Talk about a little bit what you guys do.
You kind of cut out a bit, but I
think we understood you.
Yeah. So we have a grant through the Otero County Health Department for worksite wellness. So we go to different businesses around town to provide education and do screenings for different employees. We like to start and then, you know, do one evaluation and go back a year later to see if the education we provided was helpful, if they need any help. Also, if they have values that are out of range, we like to follow up on those to be sure that they don't have any questions. If they need providers, we help to arrange appointments and try to get people in place to get, you know, to get help with preventative care. We also have a program through this grant called self-measured blood pressure. So we can actually check out blood pressure cuffs to people in the community to help, you know, they can track it on a daily basis. We'll check in with that. That way their doctor has something to go by to maybe do med management or, you know, to help control it that way.
And we give them the education on how to take their blood pressure correctly and then just follow up as much as we can just to make sure that they're on the right track.
Great. I just wanted to give you guys a chance to explain kind of what you do in your area and how you're helping members of your community. Again, we launched these online screenings in the southeast area of Colorado first. Anyone can go online right now and do the assessments, but we really want to make sure to get your resources out to rural areas of Colorado. So it's great work that you guys are doing. Someone just asked on Facebook, and I don't know who wants to take this question. Dr. Coy, maybe you can answer this one, but Ron asked, is Bayer 82 milligram aspirin still recommended as a daily regimen for heart health?
That's a great question because there's been a lot of debate in the scientific community about the efficacy of aspirin. So let's talk about the two groups that aspirin applies to. So the first group is called secondary prevention. So those are people who've already had a heart attack or stroke, people who have known blockages in their arteries. These are the people in the highest risk group. So if you're in one of those groups, you should talk to your doctor, but you most likely need an aspirin because you've already had a heart attack and stroke, and it can prevent that blood clot that we talked about from really forming on top of your blood vessels, if the cholesterol spills into the artery. And you've shown us that your body is the type that can actually have heart attacks and have strokes. So you're probably going to benefit from the aspirin. The other group is called the primary prevention group. And this is the group that the majority of us fall into. So I want you to pay careful attention. This is for people who don't have known heart disease, someone who's never had a heart attack or stroke, someone who's never really had their blood vessels looked at, so they don't have an established history of heart disease. And in these groups, we used to think the old saying was an aspirin a day keeps the doctor away. And actually, a year ago, there were 3 randomized controlled trials that were published that completely changed our thinking about this and have actually now recommended against routine use of aspirin in people. So it used to be, we used to say every man over the age of 55 should take a baby aspirin, that's 81 milligrams, and every woman over the age of 65. But now what we're seeing based on this randomized controlled data is in that primary prevention group, where those people that have not previously had heart attack or stroke or known to have heart disease should not necessarily take an aspirin, because aspirin does have some risks. It can increase your risk of bleeding. And in these individuals, it didn't necessarily provide benefit that outweighed the risk. Now, if you're diabetic or a high risk group in that primary prevention group, then you need to talk to your doctor because the risk assessment will be a little bit more personalized. But it's certainly something that we've cut back on use of. And in people over the age of 70, who we call the geriatric population, it's advised against using aspirin for primary prevention or for preventing a heart attack or stroke when you haven't had one before.
Okay, yeah, that all makes sense if there's not any risk factor there. Right, there's not really the need to start doing something like that. Someone did say on Facebook that, this is Tia, last May I was told I have Afib, heart starts racing when I'm asleep, I'm on 4 prescriptions. She thought she was healthy, never felt her heart beating hard. Is that something that's common? Any of you can kind of answer this or add to this.
You guys want to take a crack, or should I?
Go ahead.
Afib is more common actually here in Colorado because we live at higher altitude. But the risk factors for Afib include things like a lot of overlap between that and atherosclerosis, hypertension, obesity, alcohol use, intense exercise. So endurance athletes actually have a higher incidence of Afib. But atrial fibrillation is different from the heart disease that we're talking about because this is not atherosclerosis or blockages in the arteries. Atrial fibrillation is an electrical disturbance in the heart. So normally the heart beats in a nice coordinated fashion, one heartbeat at a time. When you have atrial fibrillation, think about all the cars merging onto the highway at the same time from every direction. So you get all these little electrical impulses happening in the heart that make it beat irregularly or erratically. So it's jiggling like jello. And atrial fibrillation can increase your risk of stroke, but it's not the same thing that causes stroke with atherosclerosis. So the strokes that occur in atrial fibrillation happen because you get blood pooling inside the heart because the heart's not squeezing and emptying with every heartbeat. So you actually get blood pooling inside the heart, and that can cause blood clots to form in the heart that can break off, go to your brain, and cause a blockage. So a different reason for having stroke, atrial fibrillation, a different process than atherosclerosis, and different treatment and management, but many of the same risk factors.
And either of you could add to that, or Kendra, I also wanted to just have you address if someone from your community comes in and you're educating them on heart health, or you're talking to them virtually, I guess right now, about heart health. What are some important things for them to ask their doctor about? If you tell them, hey, you need to go see your doctor, what are some important things they need to ask when they go to the doctor? Important things to know, like numbers to know for heart health.
I recommend that they follow what their blood pressure is so that they can keep track of that over time. If they happen to come to a community screening with someone like me and it's irregular, then that could be a red flag for them. They just need to know what their body's doing. They need to ask recommendations on what they can do to change their health. If their doctor has any plans or programs that they can get into to manage their weight or stress levels or anything like that.
And Taryn, I don't know if you want to add to that, and then also just what people can do when they have these risk factors for heart disease. How on top of it do they need to be as far as their numbers go?
So I think it's good to get a baseline number. Just know your numbers, where you're starting from, what you need to do to improve them, what helps to improve them. Is it genetic, or is it because you're eating too much saturated fat or not monitoring your diabetes? So I think it's really good to get that baseline and follow up on it once a year to be sure that you are moving in the right direction and making good choices.
And usually in the spring for 9 Health Fair, we have our 9 Health Fairs, and people can go and get those baseline numbers, their affordable blood screenings. We're working on ways for you to do that in your home or away from a health fair because we didn't have those this spring right now. But again, you can get your base kind of assessment really for your risk with the online tool we have. And that again is at 9healthfair.org. I put the link in the comments. So you can go there, assess your risk. And if you are at high risk, reach out to your doctor. Dr. Coley, we talked about this last week, but just, we said at the beginning of COVID, to hold back on those preventive appointments. But if someone takes our risk assessment right now and they're at high risk, is it okay that they go see their doctor now?
Yeah, I would encourage you to do that, but I would especially encourage you to take advantage of the virtual options if you're high risk, because the nice thing about preventive medicine, we don't need necessarily to examine you. A lot of it is talking about risk, talking about, how to reduce the risk, educating you. So it's very, very amenable to be done as a tele visit. So if you're a high risk person and you're still nervous about going to the office, I don't blame you, but I would encourage you to set up a virtual visit with your doctor to talk about your risk, whether that's diabetes, your blood pressure, your cholesterol, whatever have you. And as you said, Stephanie, we have many different options for checking these now that are extremely safe. You can either go to a patient service center at Quest, and they're doing a lot of measures to keep, blood draws safe and healthy, or you can even do the home test that we're going to be launching soon, where you can check it right within the convenience of your own home with just a little finger stick. But it is important to check, because remember, heart disease is not going to come and tap you on the shoulder and tell you you have heart disease, and it's not going to rear its head for many, many years. And so you could be walking around literally being a ticking time bomb with the cholesterol building up inside of you and not realizing it. So the way for you to know is to change your lifestyle early. And I like to use the analogy of a train on a track. A small change today is going to lead to a whole different destination in 5 to 10 years. And if you ask Americans what they fear the most about growing old, you'll unanimously get the answer of having a stroke. So if you can do a few small changes in your life today, salt, sugar, fat, those types of things, and prevent a potentially disabling stroke, that's tremendous for your life, your quality of life, and being able to spend your old age with your grandkids and with your family and however else you want to be able to enjoy yourself. So prevention is really empowering, because it can give you that opportunity to change the trajectory of your train so that you are in a whole different destination.
Yeah, at 9 Health, we always say own your health, and that is really truly what it is. When it's preventive, it's owning your health and getting ahead of stuff so that you don't have a big issue later, don't have big bills later, hopefully, and don't have those health issues that can really be troublesome and life-threatening. I want to thank everyone for joining us. I'm going to let these ladies go. If you have additional questions, you can post those in the Facebook comments and we can get those answered for you. Also, if you have any health questions, you can call our 9 Health Neighbors line. It's 303-698-4455, extension 2005. Leave a message and a 9 Health medical volunteer will return your call within 24 hours, usually really quickly. You can talk to a real person, ask questions about heart health, about any prevention, about COVID-19, whatever is on your mind. You can just talk to a real person and ask your questions. Thank you, ladies, for joining us, and we're going to sign off from here.
Yeah.